estate for the greatest role you do to be able to share and communicate these messages, health messages to the community, because this improves the uptake of these messages. So today, Minister of Health would like to inform the public, the public that Uganda is currently experiencing an increase in the cases of measles. But and what is measles? Measles is a deadly virus and highly contagious infectious disease. Is specifically there's an increase in persons through respiratory droppings. So it's mainly respiratory spread, the droppings, but also you have direct contact, but it poses a very serious, significant threat to children under the age of 5 years of age, and more especially those who are unvaccinated children. So please take note that the persons with measles are contagious from about 4 days when they have got infections to the time the rash appears. So you need to be able to know that actually the person being infectious starts even much more earlier. So by the time the rash appears, it's already highly contagious. So the signs, the main signs are, I will highlight 5 of them, which are the commonest. Definitely the child will present with a fever, will also present with a skin rash, and will present with a cough, and with a running nose, and then also will have red eyes. So this is that's the manifestations of measles. So if you have any child under 5 years who has got a fever, he has got a skin rash, has got a cough, has got a running nose, and then red eyes, you should be able to suspect that this could be a measles case and should be taken to the nearest health facilities. So currently, Uganda has made a commendable progress towards measles control and immunization coverage, with national routine immunization vaccine coverage ranging from, which is now at a level of 79%, from 20%. That's in 2016, 79% from 2016 to 90% in 2024, which is below the required target for measles control. The appropriate level of which we would consider to be able to stop outbreaks should be at 95%. So we're falling short of that target. But we have definitely made progress, as I have highlighted, that the progress has come from 79 in 2016 to 90% in 2024. A high coverage has also been achieved during the national campaigns conducted in 2019. We had a campaign which we conducted in 2019, and then also 2022 at 94.3% and 96% respectively. So we quite did well in 2022 compared to 2019. So measles can be prevented by giving at least 2 doses of measles vaccination, two doses of measles vaccine. It is safe, the vaccine is safe, but also is efficacious in controlling. The first dose is given when the child is 9 months, and the second dose is given, the first dose is at 9 months, and then the second dose afterwards. And the second dose should be given when the child is 18 months. So the first dose we give at 9 months, and then the second dose we give at 18 months of age. However, the outbreaks of measles continue to ravage many parts of the country, many parts of the community, especially among the unvaccinated children. So investigations have revealed that 75% of the measles cases are among the children under 5 years. So we are seeing that 75% of the cases of measles are under children under 5 years. So we also have seen that measles patients never received any measles rubella vaccination. So if you find a child under 5 years has never received measles vaccination, measles rubella vaccination, while only 33% have received only one dose of vaccine, which is not adequate for protection. As I did mention, you need 2 doses to protect you, one at 9 months and the second one at 18 months. So this is not sufficient to protect the child. So in particular, the uptake of the second dose of measles rubella vaccine given at 18 months of age during the routine immunization remains very low, with only 64% coverage in 2025 compared to 92% for the first dose of measles rubella. So you can see that there are a number of children who fall out from 95%, which is almost like 30% of the children, 31% of the children did not receive their second dose. So this gap has resulted in a large number of susceptible children despite the adequate availability of measles rubella vaccine in the country. So I want to emphasize that we've not had the stock out of the measles rubella vaccine in the country. So in 2025, a total of 66 districts reported confirmed measles outbreak, with over 10,163 cases, and we've recorded 60 deaths. Notably, 31% of the deaths have occurred in the Karamoja region. So as you've seen that, so from in our statistics in 2025, a total of 66 districts have confirmed the outbreaks, and according to our records, we recorded 10,163 cases, of which 60 of them have been fatalities in the Karamoja region. However, between January and April 2026, 20 districts have confirmed outbreaks. These are Bulambuli, Kasanda, Amolatar, Kibale, Noya, Karenga, Amur, Agago, Kagadi, Kiboga, Chegegwa, Kabong, Kotido, Kwen, Lira districts, Sembabule district, Kikube, Gulu, Kaso, Mubende, and Ajumani. Those are the districts which have reported outbreaks from January up to the end of up to today. A total of 12 measles-related deaths were confirmed in 2026. These were in Kagadi, Kikube, Ajumani, Bulambuli, and Karenga. The deaths were attributed to underlying conditions like malnutrition, a delay in seeking care, and also not receiving the measles rubella vaccine. When we did a national risk assessment, it indicates that nearly half of all the districts are in a moderate to a high risk of measles transmissions. So the current outbreaks are driven by several factors. One is low population immunity due to suboptimal vaccination coverage. Our children have not been vaccinated. Limited awareness about the role of the second dose of measles rubella vaccine given at 18 months of age, and the caretakers are not aware that Uganda is now administering the second dose at 18 months. Because you're aware that the previous program only ended at 9 what? At 9 months. But now the second dose is received at what? 18 months. So many of the parents, of the caretakers, are not aware that you have to receive the second dose at 18 months. Hard to reach populations, health services have not been provided in these hard to reach populations, such as the remote areas. Vaccine hesitancy in some communities. There are misinformation, misconceptions about vaccines, and hence caretakers do not bring the children for vaccination. So weak surveillance systems and delayed health-seeking behavior among the community members. And lastly, inadequate outbreak response capacity in some of the districts. So those are some of the things which we are observing. Nutrition complications such as pneumonia and diarrhea and delayed care-seeking behavior have contributed significantly to measles-related deaths. So if you look at the children where we have had fatalities, in addition to having measles, we also noted that they have malnutrition, they are not immunized, and then they also have other complications of pneumonia, which definitely significantly affects their causes death, and then the associated diarrhea. Among the children who survive measles infection, a proportion of them develop severe neurological or what we call nerve complications. So we need to be able to take note that, yes, you can survive what? Measles, but there's also a risk that you can develop neurological what? Complications after you have that. So this is associated with measles, permanent brain injury, and also lasting impairment, which as I mentioned are all preventable if we could get these children vaccinated. Among the children who survive measles infection, a proportion develop, I have mentioned that. So in response to the outbreak, the Ministry of Health, with support from partners, is implementing several measures, which include activation of the national and the regional coordination mechanisms for outbreak response, conducting outbreak investigations and laboratory confirmation, supporting districts-led vaccination campaign targeting all children aged 9 to 59 months, strengthening risk communication and community engagement, leveraging ongoing integrated child health days to provide measles vaccination, but also providing additional vaccination and resources to high-risk districts. We are also strengthening surveillance and capacity for outbreak detection and response. However, despite these efforts, a more comprehensive response is required to reach all children with life-saving vaccines. And that's why in October, Uganda will carry a national measles rubella vaccination campaign. So the ministry, with support from Gavi, the Vaccine Alliance, the WHO, the UNICEF, will conduct a nationwide measles rubella immunization campaign from Thursday 1st to Monday 5th October 2026. The campaign will be carried from Thursday 1st to Monday 5th October 2026. The campaign aims to vaccinate all children aged between 9 to 59 months across the country, including those in the refugee settlement communities. This campaign will target all children irrespective of their previous measles rubella vaccination. The campaign will be integrated within the Integrated Child Health Days in October 2026 to maximize the reach and the impact. So the vaccination services will be provided free of charge through the fixed, temporary and mobile posts, including all immunizing health facilities, schools and 30 outreach sites and community-based locations. And as I've mentioned, all eligible children will be vaccinated regardless of their previous vaccination. The campaign will also strengthen routine immunization systems, will enhance surveillance to measles, rubella, and also congenital rubella syndrome. We call upon all the parents, of which some of them are here, and the caregivers to ensure that every child aged between 9 to 59 months is brought for vaccination during this campaign period, irrespective of their previous vaccination. We also urge the communities